Continue that conversation about former President Biden's diagnosis with Dr. Narayanan. He's joining us from Providence this morning. Thank you so much for being with us, doctor.
Oh, thank you for having me.
Yeah, part of the conversation that people have been talking about is that we know that former President Biden's last physical exam as president was February of 2024. And now we know he has this very aggressive diagnosis. Is it normal that a doctor would not have noticed something unusual then?
It's an excellent question. So with prostate cancer, one of the keys that we have is the PSA. So the PSA is a simple blood test, and it's our modality to check where someone is with respect to their risk for prostate cancer. So our robust guidelines using the National Comprehensive Cancer Network kind of say, well, for the average patient or average person, after age 75, you don't really need to screen them. So President Biden's 82, so there's potentially a, 7-year gap from where a last PSA value was. So it's not entirely uncommon that he could have a 7-year gap between a PSA that was being checked. And men that present with these urinary symptoms, credit to the physician that said, hey, let's go ahead and check your prostate and evaluate for a nodule. So that was a way to detect prostate cancer, which is where we are now.
And doctor, we often hear of the diagnosis of prostate cancer, but we want to ask you, how common is this type of cancer, especially at the president's age of 82 years old?
Right. So across all comers, prostate cancer is the most common solid organ malignancy in American men. 1 in 8 men will get it. But at that age, it's actually more common. It can be anywhere from 50 to 89% of men over age 80 can have a form of prostate cancer.
And talk a little bit more about the specifics we know here, which is not a ton, but we know that it's being described as an aggressive form of cancer. I think it has spread to his bone in some way, they have saying, and they're saying that it's hormone sensitive. What does that mean for his survival rate and what we could see as far as treatment?
Right. So in general, prostate cancer can be localized or metastatic. And so in former President Biden's case, it's metastatic. It's spread outside of the gland. So this is not a common presentation to begin with. So assuming that this is the first time that this diagnosis has been made, we call this sort of de novo metastatic prostate cancer. And that happens about 5 to 10% of the time. Most cancers are actually localized and really are asymptomatic. Most men don't know they have it. That's why PSA screening is so important. Now, in President Biden's case, the metastatic component looks at hormone sensitivity versus hormone resistant. So hormone sensitive cancer now in the contemporary era is very treatable with androgen deprivation therapy, which is to sort of suppress the testosterone that aggressive prostate cancers like to feed on. And now with the advent of what we call androgen receptor pathway inhibitors, these are additional therapies. The survival for metastatic prostate cancer is now significantly more than it used to be even 5 years ago.
Well, that's great to hear that there are forms of treatment that can be received. Doctor, what then does the recovery process look like?
So this is basically a multidisciplinary effort. So you'll have a urologist, you'll have a medical oncologist, you'll have a radiation oncologist, all getting together to talk to former President Biden and his family to discuss the most sort of tailor-made treatment plan. So the recovery can be challenging because hormone therapy, androgen deprivation saps someone's energy level because you're dropping the testosterone. But you'll, tack on things like calcium, vitamin D to boost the bones, exercise-based regimens to sort of keep your muscle mass up. So there's several things that can, put in place to keep the treatment pathway going. And, it's just a matter of working together and making a very personal decision, which is ultimately what this comes down to. But I think he has a great team around him, I'm sure, but it's a multidisciplinary effort. So we're looking at it's a fighting road, but I think he'll do very well.
All right, we're happy to hear that, Dr. Narayanan. All politics aside, of course, we're all wishing the former president the best. And I think it's an interesting conversation because, unfortunately, so many people are impacted by cancer. So thank you for speaking with us this morning.
My pleasure. Thank you for the opportunity.